Hello dear friends, my name is Sofya Dorinskaya. I am a psychiatrist by training, the head of the Sofya Dorinskaya Center for Medical Information, and the head of the International Bureau for Human Rights in Mental Health. Today I would like to touch on such an interesting topic as autism in children. And now autism is coming to the forefront, so to speak, in terms of the ranking of problems. Well, if not on par, then at least comparable to schizophrenia. If we start to look into and study the topic of what autism actually is, we find that it is nothing more than a description of a person's behavior, and the range of descriptions is quite broad. From cases where a child really sits in the corner, communicates poorly, speaks little, or is already starting to have some speech problems or already has them, to outright psychoses. All of this gets lumped together and is called autism. And if a child does poorly in school, if they have trouble absorbing material, if they have some neurological problems, if the child is small, right? No one even tries to find out whether they are experiencing any physical pain or not. And all of this gets thrown into one pile, including children in an outright psychotic state. This is all called autism. And the path, so to speak, is already well trodden to the psychiatrist. Then the path leads straight to the pharmacy for these psychoactive substances. And in the end, we see children who have already been turned into vegetables. In the end, we see children whose development has stopped and the problems only get worse. So, I want to return once again to the beginning of all our videos about psychiatry and say that behavioral symptoms always have some kind of physical cause. Autism is not a disease as a separate category where it is known what causes it, how it develops, and what outcome it will have. It is simply a description of similar or roughly similar behavioral traits. But the most interesting thing is that at the root of each of these conditions lies one or another physical pathology, which is either not looked for or people don't know how to find it, or when it is found, they don't know what to do with it, and so on and so forth. In reality, from everything I see, they simply don't look for it. Honestly, I don't know what's going on in the doctor's mind. It feels like they just shut their mind off, prescribe nootropics, and then move on to psychoactive substances, even up to antipsychotics. And in general, the person doesn't want to reason or even look into this area at all. Well, as for the parents, the doctor said something, so they just go along with it, so to speak, following the usual path. So today I want to tell you about the possible causes of the condition known as autism, and also give you the first step to addressing this condition. A step that should always be taken, simply because it is biologically justified, safe, and always effective. So the causes can be different. There can be severe deficiency states, for example, such as pellagra. This is a severe deficiency of vitamin B3, and if it is not addressed, this condition is fatal. Pellagra comes in different forms. It can be acute, it can be prolonged, it can be absolutely varied. There are also deficiency states such as scurvy, which can also be acute or chronic. But since these are deficiency states, you need to know about them, be able to identify them, recognize them, and honestly, you need to remember them when a doctor comes to see you. Here's a small nuance. Another situation is when a child may be somehow different or not quite right from birth. This could be due to toxic intrauterine exposure. For example, when the mother took certain medications, and nowadays pregnant women are often prescribed medications. I don't know, in the past a pregnant woman was untouchable, written in big letters. Pregnant women were always considered untouchable when it came to any medications, and doctors would look for every possible way to avoid, God forbid, giving a pregnant woman anything more serious than raspberry jam. But now, pregnant women are prescribed everything from A to Z, including atypical antipsychotics. You can watch our videos about Circle and so on. As a result, all of this affects the child's mental state simply because the child is poisoned in the womb. The next condition that can be a cause of autism is so-called celiac disease. This is a recently identified disease. It is a disorder of the body's ability to absorb gluten, that component found in bread, pasta, and so on in wheat. which, because it is not absorbed by the body, turns into a toxic form. But the most interesting thing is that it's actually quite difficult to make such a diagnosis definitively, because tests for celiac disease are quite expensive and not everyone can afford them. So dear mothers, if you notice that your child is somehow different, if you see that they have trouble absorbing educational material, what should you do first and foremost? It is absolutely essential that before you ever consider administering to your child any psychoactive substances or various types of stimulants such as nootropics, you must make sure you have your child professionally tested for any underlying nutrient deficiencies. Because addressing and correcting nutrient deficiencies is essentially about bringing the body into physiological balance, specifically in terms of its overall growth and development. The body cannot develop if it has any nutrient deficiencies, if there are severe deficiencies, or a person may have a congenital deficiency. Yes, a person may be formed normally, head, arms, legs, all in place, but they may have a congenital deficiency and the body suffers and the child's development lags behind simply because the body lacks the strength. Identifying nutrient deficiencies is always safe, because the safest thing you can do for your child is to feed them properly, because vitamins, minerals, and trace elements are supplements to food. They are natural substances from which the body is built. And you should clearly understand that a child's body has a very large capacity for recovery. And you should clearly understand that by properly adjusting your child's nutrition, you can truly help their body flourish. And gradually this psychosymptomatology will improve, simply because the body gains the ability to develop normally, including the proper development of the brain. Because, for example, one of the cases we're currently observing, people we are in contact with, their child was diagnosed with demyelination of nerve fibers. It turned out that the child had a severe deficiency condition, and simply by properly taking a combination of vitamins, minerals, and trace elements. Now let me tell you, we've been in contact with this child's parents for 2 months. The child is already starting to speak little by little, whereas 2 months ago he didn't speak at all, he didn't make any sounds, he didn't sleep, he could barely walk, and so on and so on. Therefore, the first thing you should do, the safest thing you should do, is to check whether your child has any nutrient deficiencies and eliminate them, and bring your child's body back to normal, relieve it from hunger-induced suffering, if you will. And then, on this foundation, if there are still any pathologies in the body, then it's necessary. We still help. When we supervise a person, you can see how the deficiencies disappear. We already know from extensive experience what kinds of problems may arise. We advise people to see certain doctors, to get some tests done, and as a result, other conditions may be revealed, which are most likely a consequence of this deficiency, but nevertheless, doctors will make the necessary adjustments. But if you do not address the deficiencies in nutrients, then no stimulants, and certainly not, God forbid, any psychoactive toxins, which is what all psychiatric substances are, will ever lead your child to thrive, to succeed, to develop, to become intelligent, to improve their academic skills, and so on and so forth, because only a healthy person can be successful. A sick person cannot be successful. And the first thing to do when a person falls ill with something is to identify their nutrient deficiencies. Identify them, eliminate them, and only then can we talk about anything else, about any further development. Therefore, dear parents, if you suspect that your child has autism, or if your child has already been diagnosed with autism and referred to a psychiatrist, first and foremost, you should come to us. Because at the very least, interacting with us is safe, and it's also effective. And believe me, you will be very grateful to us in the future. This was Sofya Dorinskaya with you. All the best. Goodbye.